Hi friends, I am Dr. R Anam. I am a Mumbai-based breast cancer and breast oncoplasty surgeon. So today I am going to talk to you about what is breast cancer surgery. So let's divide breast cancer surgery into two parts. So whenever breast cancer surgery is done, it is done both for the breast as well as for the axilla. So right now I am going to talk first about the breast part. So whenever indicated, if there is an option, then breast surgery can be done as a breast conservative treatment or it can be done as a mastectomy. Breast conservative treatment means we remove the tumor along with a safe margin, and after that we need to do some form of reconstruction, oncoplasty for example, versus mastectomy means that along with the tumor we remove out the entire breast. So I hope you are understanding breast conservative surgery with oncoplasty versus a mastectomy. But here comes the important point. Whenever breast conservative surgery and oncoplasty is done, this has to be followed up by radiation therapy also. There is no way out that you avoid radiation therapy, you just do a breast conservative surgery. So am I being clear that breast conservative surgery with radiation completes the treatment on this side, versus for mastectomy there are certain indications where radiation becomes essential. So those indications are: number one, if the tumor size is more than 5 centimeters, then even if you have done a mastectomy you will need radiation. Number two, if the tumor has caused ulceration on the skin, then even if mastectomy is done you will need a radiation therapy to add on to it. And number three, when the axillary surgery is done, if any one of the nodes is also positive for cancer, then after mastectomy also radiation therapy needs to be done. So if in case you have undergone mastectomy and you don't have these three things, your tumor size is less than 5 centimeters, the skin is free, there is no ulceration due to tumor, and there is no positive axillary node also, then after mastectomy you do not need radiation therapy. So I hope I am clear about this. Now let's come to the axillary part of the surgery. So axilla is divided into three parts: level 1, which is below the pectoralis minor muscle; level 2, which is behind the pectoralis minor muscle; and level 3, which is in between the pectoralis minor muscle and the axillary vein going above. So earlier we used to do complete axillary clearance where all level 1, 2, 3 were excised, but there is high morbidity associated with this procedure, which includes life debilitating lymphedema also in 4% of the patients. So now we have an option of doing sentinel node biopsy, whereby we excise just those 2 or 3 nodes which are identified during the surgery with the help of some special dyes. So these nodes are sent for frozen section. Frozen section is a histopath reporting which is done when the surgery is going on. So within 30 minutes they tell us that these 3 nodes are free of cancer. If these 3 nodes are free of cancer, we need not go ahead with complete axillary clearance or a low axillary sampling, which is an anatomically defined portion. We send those few nodes which are lying in that defined portion for histopathology frozen section, and within 20 minutes they tell us that all these nodes are free of cancer. So we need not do the axillary clearance and increase the morbidity of the patients. So this was in short about breast cancer surgery. So if you have any doubts or queries, do write down in the comment section below. Me or my team will get back to you. Thank you.